Hi everyone, my name is Heidi Cook and I am a grad student. I am here today to tell you about my recent research project. I wanted to start out by giving you a little context through a story, and I'm going to tell you about Sam. Sam is 31 years old and grew up in a rural town in northeastern Oregon. He was naturally athletic and loved sports that gave him an adrenaline rush. When he was in grade school, he was already keeping up with the high school kids in the skate park and on a snowboard in the mountains. He started to compete competitively. Over this time, he had quite a few accidents and injuries that resulted in broken bones. In fact, when he was 14 years old and at the skate park, he was coming up from skating in the bowl, and he lost control of his skateboard, and it flew straight into his mouth when it was going super fast. This resulted in years of surgeries and serious jaw and dental work. During this time, as well as with other injuries, he was prescribed a lot of opioid painkillers, including big name brand drugs such as oxycodone and Vicodin. At the same time nationally, we're talking about the late 1990s and early 2000s, physicians were writing a record number of prescriptions for these prescription opioids. And at the same time, the first wave of opioid overdoses were just beginning. Back to Sam. His prescribed pain pills he needed to reduce the excruciating pain of his injuries became an addiction that led him to abuse the prescribed pills. This eventually led him to use heroin. During the same time nationally, we were entering the second wave of an increase in opioid deaths. This wave began in 2010. At this time, there was a rapid increase in opioid overdoses involving heroin. The tighter regulations on prescribed opioids combined with the rising costs led people with an opioid dependency to the cheaper and now more accessible heroin. Fast forward a few more years. Sam has moved to a big city in another state. He overdoses more than once, but he doesn't die. After the last overdose, he's jobless and he's homeless. He comes back to his home in Union County, Oregon. Unfortunately, heroin is now readily available in the rural parts of the country. A nurse in Union County described seeing heroin overdoses in the ER on a regular basis. An exhausted parent voices her struggle to find any support for her and other parents dealing with children struggling with opioid addiction. Sam feels hopeless with the lack of services or support offered in the area. The closest treatment center is located 4 hours away. Many Eastern Oregon locals have stated that drugs like heroin are just a problem in Portland. The Union County Drug Force has no mention of opioids on its website outlining the local drug issues they're tackling. Yet Sam, the nurse, and the struggling parents paint a different picture. The purpose of the study was to determine if Union County has a higher prevalence rate of heroin abuse than Portland, Oregon. I used a single system research design because we're still at the point where we need a needs assessment. Researchers collected emergency medical services reports on how many ICD-10 codes were used at the one hospital in Union County, which is Grand Island Hospital, and any public general hospitals in the city of Portland over a 9-month period from March 1st to November 1st, 2018. The ICD-10 code is the code that they use in the hospital when someone has overdosed on heroin. A chi-square test was conducted to compare the results of frequency rates of the two different populations. The results of the prevalence rates combined with using a chi-square test to find out if there was statistically a significant difference in the frequency rates showed us that compared to Portland, Union County had more heroin overdoses per capita from March 1st, 2018 to November 1st, 2018. The study produced a clear graph representing a visual portrayal of data. This information can be used to share with local news outlets, health officials, law enforcement, mental health care workers, and city officials. The first part of tackling a problem is understanding that there is a problem. This can make a large impact on changing communities' perceptions and showing the need for intervention. Hopefully, having this timely data will increase the efficiency of response. And hopefully in the meantime, Sam can find the support he desperately needs and the desire to take it.